All right, ladies and gentlemen, now let me introduce to you our second speaker. He is the founder of Become, a fellow of nutrition and environmental medicine, and a fellow in prevention of chronic disease and cancer management. At the same time, he is a leading researcher in clinical cupping therapy. Meanwhile, he is an author of Rabatan, Diabetes, Science Become, and Blood Cupping Therapy, as well as publishing scientific papers and presenting at the national and international levels. He is also active in green medicine and integrative medicine movement, where he is the vice president of the Malaysian Association for Advancement of Functional and Interdisciplinary Medicine. Today, we are really glad that he will be around here to share with us the common disease among the old age group. So everyone, all my friends, let us welcome Professor Dr. Abdul Aziz Al-Safi Ismail. Let's welcome.
Hi, thank you very much, PE, for having me in this forum. Today, I'm going to share with you common diseases among old age group. What is aging? So, aging is not a disease and it's occur at different rates among individuals and within individuals, and does not generally cause symptoms. The characteristic of aging is a cellular and physiologic deteriorations, and it increased mortality with age following maturation, increased vulnerability to disease, and decreased ability to adapt to stress. This is because of the impaired homeostasis. And age-related physiological changes, all people age but not at the same rates. And if you compare at age 75, the average person compared to age 30, 92% of brain weights, 84% basal metabolism, just by aging only, 70% kidney filtration rates, 43% maximal breathing capacity. So we are not the people we once were because of aging. What is the normal aging physiology? Aging physiology all decrease. If you compare the age of 30 as compared to age of 90, you can see the reductions in conduction velocity, reduction in basal metabolic rate, reduction in standard cell water, cardiac index, standard glomerular filtration rate, meaning that the way that your kidney filter the blood is reduced. Vital capacity reduced, standard renal plasma flow reduced, standard renal plasma flow reduced, and all this maximal breathing capacity also reduced. That's why you see the aging people, we have all reduced in capability of running themselves. So the physiology of aging can run from skin, body composition, vision, special sense, hearing, and nervous system, musculoskeletal, renal, GI, and cardiovascular. Let's see what are the changes. In this table, you can see the physiologic changes in the dermis with aging. Skin more easily damaged, delayed wound healing, decreased inflammatory response, decreased protections from ultraviolet lights, decreased urticarial reaction, wrinkling, sagging skin, skin easily stretched under low loads, loss of resiliency, diminished absorptions, altered thermal regulation, and decreased sensitivity to pain and pressure. This is for the skin only. And you can see the wrinkling of the skin, all parts of the face, for example, forehead, around the eyes and the thing. Muscle of the face are capable of tremendous movement. Smile, laugh, frown, disappointment, anger, rage, and surprise are all recorded. The hand of time captures these expressions and outlines them on the face. By the age of 40, most people bear the typical lines of their expressions. The reason for the wrinkling occur because of the loss of subcutaneous fat. If you look at here, the diagram of the skin, significant number of fat or subcutaneous tissue will be lost by aging. And this will less insulation of body to cold, meaning that they cannot handle or affected by the extreme temperature. Okay. Body composition change from at the age of 25, for example, in this diagram, you can see compared to the age of 70, fat content reduced, fat content increased from 20 to 36%, but the cell mass reduced from 47 to 36. Bone structure reduced from 6% to 4%, and other parts of the body also reduce at the age of 70 compared to the age of 25. Central obesity also increase as we grow old, both for men and women. You look at this picture, gentleman on the left as compared to the one in the right. You see, look at the body structure. More and more fat being deposited at the central. This is what we call central obesity. This is more of it. Now, age-associated factors. One is for the vision. You can see the reduction in the visual acuity because of cataract, because of the macular degeneration. Dark adaptations will be reduced. Peripheral vision because of the glaucoma, contrast sensitivity and accommodations also affected. For the other sense like auditory and vestibular, hearing, high frequency hearing loss, vestibular dysfunctions, inability for this group of people to the disability for the adjustment of the balance, cannot balance themselves. Smell also affected, oral or dental. 40% of the elderly are edentulous, taste, salivary functions also affected. For the nervous system, CNS, for example, decrease in nerve cell number, basal ganglia atrophy, decrease secretion of dopamine and muscular rigidity, decrease in step height, increase reaction time, and decrease in vibratory sensations. On musculoskeletal, 30% loss in muscle mass, third to eighth decade. This is what we call sarcopenia. Another problem is osteoarthritis, weight bearing, pain at the spine, knees, first metatarsophalangeal, repeated strain, and osteopenia or porosis of the bone. For kidney function also reduced in GFR or glomerular filtration rate, meaning that the ability of the kidney to filter the blood also reduced between 30 to 46%. Decrease in tubular function, decrease in the renal plasma flow by 50%, 50% reduction. So this is real significant. For gastrointestinal changes, you can see the reduced absorptive cell, meaning that the ability to absorb nutrient will be reduced. GI motility, meaning the movement of the bowel also reduce. Sphincter activity reduce. This will cause the disease like we call GERD, gastroesophageal reflux disease. The reduce in blood flow to the intestine in GI system, decrease in gastric acid secretions, and decrease in the active transport of the cell. Okay. The other changes in the vascular or in the blood vessel, vascular smooth muscle changes, increase thickness of the intima and media, and reduce in collagens, increase fibronectin, cross-linking. Okay. Another associated changes in the cardiovascular physiology related to the maintenance of resting left ventricular function. This will lead to the blood, the heart cannot function properly. Okay, this one we skip for this one, and then there is the role of exercise. Role of exercise. Here we skip for this one. All the people should stop exercise and rest. Is that rather than seeking permission to exercise, you should have to get permission to be sedentary. So exercise is a must even for elderly. This one, for example, the aging. In the aging, fat mass will be increased, bone mineral density reduced, VO2 oxygen maximum reduced, muscle strength reduced, glucose tolerance reduced, insulin sensitivity reduced, and cholesterol increase. So this will lead to the other diseases like diabetes and hypercholesterolemia. And benefit exercise for the elderly like weight loss, blood pressure decline, aerobic capacity increase, insulin sensitivity increase, increased bone mass, increased muscular strength, and increased perceived well-being. So this is the real benefit of the exercise in elderly. Like this one, I think I skip this one. Okay, another problem with elderly is about the protein-calorie malnutrition. It's occur quite common, 5 to 12% in the community, 30 to 61% in hospitalized groups, and for even higher in the long-term care facilities, up to 40 to 85%. Protein-calorie malnutrition, meaning that they don't have enough food actually. What are the reason for this? The reason for this actually because of the increased severity of diseases, increased possibility of physical limitation due to decreased musculature, decrease in functional status, and increased drug effect due to change metabolism and weight loss. So that other adults are increased risk of inadequate diet from diseases, physical limitation, inability to chew or poor oral health, social isolation, impaired functional status, even worse with the alcohol use or misuse and abuse, and also drug interactions. So this is another cause of the malnutrition. I think I skip for this one. I want to go to the more important issues in the elderly, like musculoskeletal disorder. You can have all the list of the musculoskeletal disorder, start from the neck pain, golfer elbow, herniated disc, and all the problems at the joint. This is real problem in elderly. Arthritis, like this one, or arthritis. This arthritis meaning that inflammation or degenerative changes in the joint occur worldwide. Cause unknown, referred as the degenerative joint diseases, the most common problems among elderly. Another one is rheumatoid arthritis, chronic systemic inflammatory disease of the connective tissue. You can see at the various degrees. This is very painful and then very difficult to handle. Another one is what we call osteopenia. Osteopenia because of the gradual loss of bone that reduce skeletal mass without disrupting the proportion of mineral. Like this one, osteoporosis. This occur in 1 in 3 in women and 1 in 5 men over 50 with experienced osteoporosis. You see, because of the genetic, meaning that it run in the family. Another one because of the inactive lifestyle, old age, over 45, insufficient mass, and then because of the growth, stunted growth. And how to prevent is to prevent from early stage, proper diet, more of the antioxidant drug, milk, dairy products, rest, enough rest, vitamin D, exposure to the sunlight, very important, stop smoking, limit alcohol, and then caffeine in your drink. Another one is called sarcopenia, as mentioned, because loss of muscle mass that occur with aging. The cause not known, but is preventable. That is through proper exercise. Another one is because of what we call gastrointestinal system, atrophy of the secretion mechanism, decreased motility of the gut, lost strength, and this will cause the poor absorption and cause chronic constipation. And from chronic constipation, we have all other diseases like cancers and other things. Like this one. This is causes of upper and lower abdominal stomach symptoms. Upper side of the system like GERD, gastroesophageal reflux disease, peptic ulcer, gastritis, gastroparesis, and gallstone. For the lower abdominal stomach symptom, celiac disease, that means in the poor absorption, you can have continue with problem with the absorptions, uh, diverticular disease, inflammatory bowel disease, and irritable bowel syndrome. So we have ways actually to overcome this by changing their diet. Another important, in fact, this is the most important problem in elderly, that is the cardiopulmonary systems. You see, in the absence of disease, the heart tend to maintain the size. However, as you grow old, heart valve also tend to increase the thickness with age. BP tends to go up, and then blood vessel tend to be blocked because the arteriosclerosis. You see, narrowing of the arterial passage as a result of the development of plaque on their interior wall. And this can be overcome by using the ECP machine, which I will describe later on. Another one is atherosclerosis. This is the loss of elasticity of the arterial wall. Yeah. Another one is the respiratory changes. Airways and tissue become less elastic and more rigid. Then you can have decrease in lung elastic recoil, small air entry, and you have all the problems related. Another one is the urinary system. The bladder of an elderly person has capacity of less than half that of a young adult. So that's why they need to go to toilet frequently to empty their bladder, because the capacity of the bladder is only half of the normal, meaning that can be easily full. So maturation reflex is delayed, meaning that usually activated when bladder is half full. In elderly, this will be less happening. Then genital problem, also we have problem with things. Female genital tracts become folds become less pronounced, skin become thinner, vascularity and elasticity also decrease, become more susceptible to tissue trauma and other things. In internal reproductive organ, uterus decrease in size, then become more fibrous, we become male genital system. So what is the current approach? With the current approach, you can see the problem that we have at the moment, medication and cost increasing, ward is so busy and full, insufficient dialysis center, and all this problem happening. So in order to stop this graph coming up with all this medical problem, we have to change the perspective. We have to change the way that we look. So the solution is you look at this what we call healthy triangle. You have so the to overcome the problems, all these medical problems, it's not only through the medication, but through a systematic approach. That is to do a detox process, meaning to remove the toxin from the body, then to look after your circulation, your blood flow, the thing, then can help look at the nutrition aspect, and the other one in immune system. So if you look at this type of healthy triangle, then you can easily overcome problems of this nature. Okay, I think with that, I think I end my presentations here. So this is the perspective at the moment. Then to look at the problems of elderly, we have to have a complete perspective to tackle the problems. So I think that's about all that I want to share. Thank you very much.